So whilst on this medication, the big change in terms of what you can and can't eat or drink is alcohol. And the reason being is the risk of something called pancreatitis, which is inflammation of your pancreas. Now, the two biggest causes of pancreatitis anyway are alcohol and gallstones. And these medications carry a very small risk of pancreatitis. So obviously if you combine them with alcohol, you increase that risk further. In general, foods that you want to avoid, a lot of it will depend on how you have sort of got along with the medication to start with, and depends on any side effects you might be having. So, for example, some patients can experience diarrhea in the early stages of taking this medication. In those cases, we would ask people to avoid particularly greasy foods and things like that. Depending on how a patient has sort of started with the medication, we generally recommend a more bland sort of diet if you're having gastrointestinal symptoms like nausea or vomiting or anything like that. But by and large, these changes tend to happen naturally for people once they start the medication.